Good afternoon, everyone. I am Dr. Baveja, Professor Baveja. Before starting this lecture, we just have a round of introduction from one side.
Sir, myself Meera Sanish, working as nursing officer in AIMS New Delhi.
Okay. Next one.
Sir, myself Surbi, working as a nursing officer in District Hospital Fatehbad, Haryana.
Okay. Next one. Pramod. Pramod Sharma. Seema Pal. Seema Pal. Manisha. Manisha. Is Manisha there? Is Seema there? So let's start with the lecture, which is interrelationship between health and environment. We will be discussing about how environment is affecting our health, how we can prevent, how one should be careful that health should not be deteriorated by the environment, right? So all of you know that healthcare waste is there, biomedical waste is there. So healthcare waste includes the waste generated within the healthcare institution, facilities, any center, any laboratory, whatever medical procedures are going on anywhere, whether it's a laboratory, it's a nursing home, it's an institution, whatever waste is generated, that is a healthcare waste. And biomedical waste, what is the definition of biomedical waste? Definition is any waste generated during the diagnosis. Diagnosis means in the laboratory, some cultures are going on, for diagnostic purposes. Treatment, for treatment, we are using syringes. So, or vaccination, immunization, syringes are used. Or some animals are used, or some research activity going on. And so in that also production is there. So it is any waste generated during the diagnosis, treatment, or immunization of human beings or animals or research activities pertaining thereto, or in the production or testing of biological or the health camps, including the categories mentioned in Schedule 1 appended to the Biomedical Waste Management Rules 2016 as amended by Government of India. So these are the various sources from where biomedical waste can be generated, and we should be very careful about handling of biomedical waste and disposing of biomedical waste. And so if you are not handling it properly, you may be infected with the various diseases, because biomedical waste may contain some microorganisms which can infect you and you get a disease. So healthcare waste, it may be general waste. It's a 85% is general waste, which is non-hazardous. General waste means non-hazardous waste. This is non-hazardous healthcare waste. This one is 10% infectious waste, hazardous healthcare waste. And 5% is chemical, radioactive, hazardous healthcare waste. So these two categories are healthcare which are hazardous. This is non-hazardous. So we should be very careful that this waste should not be mixed with general waste. General waste is paper and other things, right, which are not infected. If you mix this waste with the general waste, whole of the general waste will be infectious. If whole of the general waste is infectious, then more chances of infection to the person, and also disposing of the waste will be very costly. Cost will be more while large amount of waste is disposed of. So, and even for that, you have to separate this waste because it has become infectious. So segregation of the waste is very important. If you do proper segregation, then it will not be mixed with the general waste. And if less amount of waste is there, then cost will also be less. So this is a percentage of infectious waste in the healthcare facility. Then what are the locations of infectious waste? You are working in a hospital, you just think of any area, you will find wherever some procedure is going on, you can get the infectious waste. So whether it is emergency rooms, whether it's a labor room, operating room, operation theaters, general wards, laboratories. So like in operation theater, you may find that uh, contaminated material may be there. It may be sharps, blades may be there, scalpel may be there, maybe some chemicals used on the patient, then linen used on the patient, gauze pieces used, or maybe some body parts may be there. And so these wastes are infectious because most of them are contaminated with the blood and body fluids. When operation is going on, blood is also there. So body fluids are also secreted. So these may infect all these material. Then comes the emergency rooms. In emergency room also you find that needles are used, syringes are used, blood bags are used, urine bags are used, IV set tubings are used. All are become infectious because these are used on the patient. Then labor room. In labor room also you will find same thing. Blood bags, blood may be there. And in this especially you will find placenta may be there because labor room deliveries are going on and dead fetus may be there and soiled linen may be there and infected gauze and pads may be there. In general wards also one is using swabs are used and sharps are used, scalpel blades, and blood soak dressing because in general ward dressing is going on. So all dressings which are blood soaked or which are taken from the patient are infectious. Then infected blood and body fluids. In the laboratory, testing is going on, especially microbiology laboratory contains the various infectious material. So microbiological and pathological waste may be there. Then culture plate, because you are growing the bacteria on culture plates in microbiology laboratory. So culture plates may be there, and stock culture may be there. Then solutions used in the laboratory. Glass slides are used for making smears and diagnosis. So glass slides containing the fluid, the culture from the culture plate, some bacteria you are making a smear and then looking that smear for identification of that bacteria. That glass slides are there. Then swabs used for throat swab or some other, because in microbiology laboratory you will find some pus swab has come for diagnosis, some throat swab may be there. So all these swabs after using for diagnosis, they are biomedical waste because they are to be disposed of. And then bins used to collect waste if not labeled or segregated. So mixed waste which contain different types of infectious waste and renders the whole waste. As I told you that if mixed waste is there, if bins are separate, bins are there for each waste, then there is no problem. If mixed waste you are using in a bin, then whole of the general waste also becomes infectious. Then hospital linen laundry. So linen or laundry contaminated with the blood or body fluids. Then dental setting, when you are going to a dental surgeon, they are also using sharps, some blades are used, scalpels are used, swabs are used. So infected teeth may be there because tooth extraction is there, that is, tooth is infected, and blood is also there in the while extraction of the tooth. And so all these are the biomedical waste. Then what are the sources of infectious waste? So sources, as we have already discussed, that healthcare facility, any healthcare facility or its environment is an ideal place for harboring infection. And hence healthcare facility is a disease transmitting source. Reasons for disease transmission, because infection transmitted to the visitors, number one. Visitors have come to for patient to visit patient. So these infections transmitted to the visitors may be there by the patients. Visitors may get infection because while patient is coughing, sneezing, or touching the physical environment like raising when visitor has come, that is using the on the stairs, raising has been used. So physical environment, because raising may be infected, so you may get it. While using door handles, they may be infected because so many persons are coming and using the door handles. And then patients themselves have a lower immunity and hence are more susceptible to infections as compared to the general public. General public, if your immune system is lower down, like in the patients, they are more susceptible. And when you are not following the standard precautions, what are standard precautions? Standard precautions are that you are using, like nurses, doctors are using gloves while handling the patient or doing the dressing, or sometimes you use the that mask is being used. Like in COVID-19, we were using N95 masks. So all are these part of standard precaution. Gowns are used in the operation theater. Gowns are used. Then goggles are used. So boots are used. So aprons are used. All these are the part of standard precautions. If you are not using the standard precaution while doing procedures on the patients, then you may get the infection. So not following the standard precautions. Then sources of infectious waste in healthcare setting. So in healthcare setting is there, whether it's a hospital or some other setting. So what are the sources of infectious? We have already discussed so many sources, but in this you may think the sources of infection. Hands of the healthcare personnel. And so that's why hand hygiene is very important. Hands of the healthcare personnel, persons who are working in the hospital, like nurses, doctors, other attendants, so many laboratory attendants, laboratory technicians. Hands is very important for transmission of the infection from one person to another person. So hand hygiene is very important. If hand hygiene is done properly, then infection percentage becomes lower down. So that's why hand hygiene is very proper. Washing of hands is very important. Then contaminated equipment used on patient. If you are using equipment on the patient and that is not sterilized, so equipment should be sterilized. Sterilized means either it should be autoclave or hot air oven or some sterilization procedure should be there. So all equipment which are being used on the patient should be sterilized and not contaminated, right? Then poorly cleaned surfaces and rooms, like in the room of the patient or other rooms or surfaces, floors, these should be cleaned properly with some disinfectant. So if these are not, if these surfaces are not disinfected properly or not cleaned, then anyone touching on that surface may get infection. Then needles and other sharp instruments. Needles and other sharp instruments should be either sterilized or should be sterilized disposable item. Like you find that in the market you get the disposable syringes are there with needles which are sterilized. So those should be used. Otherwise, person may get infected. Waste contaminated with blood or other body fluids. So another source is any waste which is contaminated with blood or any body fluid, that is any waste which is contaminated with blood or body fluid is infectious. So one should be careful that one should not come in contact with it because it is another source of infection. Then waste contaminated with feces, urine of the patients with highly communicable diseases. If waste is contaminated with the feces or urine of the patients with highly communicable disease, that also becoming. Then laboratory waste, culture plates are there, swabs are there, then slides are there. So all the material which is being used for the diagnostic purpose in the laboratory waste is, after using, it becomes infectious, and one should be careful that this is another source of infectious waste. Then health risk from the infectious healthcare waste. Who is at risk? So anyone coming into close proximity to the infectious waste, anyone who comes in close proximity to the infectious waste, and one who works at, provides or receives care of, or visits a healthcare facility is at risk of infection. Who works at means doctors, nurses, technicians, attendants, anyone who is working in the healthcare facility, or the persons who are visiting the healthcare facility, like visitors. So those living around any facility delivering healthcare services are also potentially at risk from the exposure. So any facility, those living around any facility and they are delivering some healthcare services are also potentially at risk from the exposure. So these are all persons. Anyone who comes in contact with the infectious waste is at risk. Then healthcare risk from infectious healthcare waste. Risk to healthcare staff, as I told you, that anyone, healthcare doctors, nurses, etc. Infections due to blood and other infectious spills. So it may be infections due to blood or other any spill has occurred, then also one can get pathogenic aerosols. If some material spill is there and aerosols may be also there. Then sharp injuries. If someone gets the needle stick injury while using the syringe, gets the prick of the needle stick prick. So that also is sharp injury, or by scalpel blade cut is there. So these are the risk. These are the items which can have risk to healthcare staff. Risk to patients and visitors. So visitors who are visiting there, they are at risk, and patient is also at risk because visitor may also be infected, and visitor coming to patient. Risk to the community, general public is at risk of getting infection whenever hazardous healthcare waste is disposed of improperly. If you are disposing of the healthcare waste not properly in the public place you are disposing of, then general public is at risk. And improperly discarded medical waste in open bins. Open bins means there are bins are there in the general population public, and you are putting contaminated needles, syringes, and dressing after use in the general public, putting them at risk, requiring injuries and infections. If you are putting these items in the general bins which are in the public places, and then one can get the even pickers can also get the needles out of it and can get the needle stick injury. And then risk to waste handlers. Waste handlers are who are handling the biomedical waste in the hospital or healthcare facilities. So they are at immediate risk because they are handling it, because of injuries from sharp and exposure to toxic and infectious waste. So they should be very careful, and they should be standard precautions should be used. Standard precautions, they should wear the gloves and aprons and mask, and all these precautions should be taken while handling the healthcare waste. And additional hazard occurs due to squenging at waste sites and due to manual sorting. When you are using manual sorting out of it, then you are also at risk. Then mode of transmission of infection. These photographs show some of the mode of infections. As I told you that hands are very important for transmission of infection. So through direct contact, right? Another is through infected air. The infected person suffering from some disease is leaving some droplets in the air. So infected air. And through water contaminated. Water is contaminated and persons are using that water. Then through fomites, the handle, door handles is having infectious, some microorganisms, infectious. So through infected blood, if some spill is there, so through infected blood also, touching the infected blood, or so through spill, infected blood is also a source of mode of transmission of this. Then impact of infectious healthcare waste on public health. So like sharp injuries and infections, sharp injuries can occur and infections can occur. So this is some data that in 2000 year, sharp injuries to healthcare workers were estimated to have caused about 66,000 hepatitis B. So by these sharp injuries by needle, 66,000 hepatitis B, 16,000 hepatitis C, and 200 to 5,000 HIV infection among healthcare workers. And for healthcare workers, the fractions of these infections that are due to percutaneous occupational exposure, percutaneous, I mean some in the percutaneous in by needle they are getting it. So HPV 37%, HCV 39%, and HIV 4%. Then impact of healthcare waste on public health by antibiotic resistance. If antibiotic resistance is there, then also so ability of microbes to resist the effect of drugs. Antibiotic resistance means those microbes are resistant to drugs. There is no effect of those drugs on that microbes. And infections with resistant organisms are difficult to treat. They are difficult to treat. This is example of how antibiotic resistance spread, right? So this George is stays at the home and in the general community, spreads resistant bacteria. So that George is spreading the to this in the community. Then George gets care at the hospital, nursing home, or other inpatient care facility. He is taking the care, and so resistant germs spread directly to other patients. So George is taking care of his problem at the healthcare facility and is having resistant germs which are spread directly to other patients who are there in the hospital, or indirectly on unclean hands of healthcare providers. So indirectly also hands of healthcare providers can be contaminated, and resistant bacteria spread to other patients from the surfaces within the healthcare facility, from the surfaces also, because George is spreading this resistant bacteria. And these patients go home, and then they also spread to the community also. So this is a animals, how animals get. This was the human beings. Animals get antibiotics. People are using antibiotics on animals and develop resistant bacteria on their guts, in the gut of these animals, and these sheep and pig and other poultry. So antibiotics are used. So they get they in their gut animal drug resistant bacteria. So drug resistant bacteria can remain on the meat from animals when not handled or cooked properly, and bacteria can spread to the humans. So this bacteria will spread to the humans in the community. So another is fertilizers or water containing animal feces, and drug resistant bacteria is used on food crops. On food crops, what you are using is fertilizer, or water you are using is containing animal feces and drug resistant bacteria. On the vegetable crops you are using it. And then again, so these drug resistant bacteria from the water and fertilizer is coming on the crops, vegetables, and drug resistant bacteria in the animal feces can remain on the crops and eaten by the persons in the community, and these bacteria can remain in the human gut. So this will also, so simply using antibiotics create resistance, and these drugs should only be used to treat infections, right? So misuse of antibiotics should not be there. Then impact of infectious healthcare waste on health and environment. So there are categories of infectious waste are there. like sharps, cultures and stalks, blood and body fluids, pathological waste, selected isolated waste. Then location of infectious waste. Location is, these are the categories from one can get infection from these materials: sharps, cultures and stalks, blood and body fluid, pathological waste, isolated, selected isolated waste. Then what are the locations of infectious waste? Hospital linen, laundry, dental settings, operation theatre, emergency room, labor room, general wards, bins for collecting solid waste, laboratories. These are the location of infection. Then sources of healthcare waste. Hands are very important. Hands of healthcare person, contaminated equipments, dirty rooms, shops, laboratory waste, waste contaminated with the feces and or urine of patients with highly communicable diseases, waste contaminated with blood and body fluids. Then next comes the healthcare facility harbors infections. Patients carry infections. So because all healthcare facilities have patients, so which who carry infections. Patients have lower immunity. Healthcare worker constantly exposed to infections. So healthcare workers working in the healthcare facility are also at risk. Then management of infectious waste, how to manage. So sharps, culture and stocks, blood and body fluids, pathological and placental waste, selected isolation waste, wastewater. So these infectious waste, all these should be sterilized. Like sharps should be sterilized while using, culture and stocks should be disposed of properly, and blood and body fluid all should be disposed of properly. Impact of infectious waste, infectious, so it can produce infections, and also because if antibiotic resistance bacteria is there, then person get the infection with these bacteria and very difficult to treat. People at risk, all healthcare staff are at risk, patients are at risk, community are at risk, community is at risk. Then prevention, policy program, designing, planning and training. So prevention is the only solution, and policy should be formulated, and planning and training should be given to the persons how to handle biomedical waste. Then hazardous nature of chemical waste. Chemical, these were the what we talked till to now was infectious waste. Now coming to chemical waste. Chemical waste consists of discarded solid, liquid, and gaseous chemical from various diagnostic and experimental work, from cleaning and disinfecting procedures. So either you are using these chemicals in the laboratory for diagnosis, or you are using these chemicals for disinfecting procedures. So infectants are used for disinfecting various instruments or the surfaces. So these disinfecting procedures. Then according to WHO, chemical waste generated from healthcare sector is considered to be hazardous. So it is hazardous if it has at least one of the following properties. So when should it be hazardous? Number one, toxic. Fumes, dusts, and vapors from the toxic material can be harmful as they can be inhaled and pass quickly from the lungs into the blood. So, person is having chemicals which have fumes. So, vapors are there. Person is inhaling it is going to the lungs, and then and into the blood. So in the lung problem may be there, respiratory problem may be there, into the blood, then may have a toxic effects may be there. So if it's a toxic, it is a hazardous. Corrosive. Corrosive is strong acid and alkali bases are highly corrosive, and if splashed on the skin or ice can cause serious chemical burns. If this strong acid and alkali are come in contact with the skin, so will produce chemical burns, and if it goes in the ice, then it will damage to the ice. Then it should, it's if it's explosive, some chemicals may be explosive, like flammable liquids can explode when ignited in confined spaces. and can cause the uncontrolled release of compressed gases. So gases will be produced if it explodes, and then those gases can be inhaled, and then again a health problem may be there. Then flammable, these compounds catch fire easily. Flammable means catch fire easily, burn rapidly, spread quickly, and give intense heat. So this will be a hazard because it will be burning the materials nearby, and it will spread quickly because fire is maybe there. And chemically reactive, these materials should be used with extreme caution and stored in special containers, because if it have a chemically reactive with some other chemicals, then also it should be stored separately. Then globally harmonized system or GS of classification and labeling of chemicals. So this GS defines and classifies the hazards of chemical products and communicates health and safety information on labels and safety data sheets. Idea is that if you have a safety information on the labels, then you will be careful. So the GHS globally harmonized system says that on hazard of chemical products, and so this safety information should be there on the labels. Major elements of GHSR: classification of the hazard of chemical according to GS rules. So one should classify the hazards of chemicals. And GHS provides guidance on classifying pure chemicals and mixtures according to its criteria or rules. Communication of hazards and precautionary information using safety data sheets and labels. So communication should be there that it's a hazardous material, and what are the safety data sheets should be there. So labels with the GHS, certain information will appear on the label. For example, chemical identity, what is the name of the chemical? Standardized hazard statement, what hazards may occur with this chemical, and symbols according to the classification of that chemical or mixture. Some symbols are there. We will be just talking about the symbols later on. That symbol is there. So by seeing the symbol only, you will identify that what is the classification of this chemical. These are the symbols. So first symbol is, it's a corrosion. So if this symbol is there on that label, it means it's a corrosion. It can burn, skin corrosive, burn, eye damage, corrosive to metals. So this exclamation mark is that it's an irritant, skin, eye, and skin sensitizer. So exploding bombs. So it can explode, explosive, like the bomb. Flammable, fire is there. So flammable. Gas cylinder, if gas cylinder type thing is there. And skulls and crossbones are there for acute toxicity. So this chemical may produce acute toxicity, and it may fatal also or toxic. Then environment, aquatic toxicity. This chemical may, if goes to the environment, like in the water, it may give toxicity to the fishes and other aquatic animals. And then health hazard. This is a health hazard symbol. That it may be carcinogenic. It may produce cancer. It may be respiratory sensitizer. Respiratory problem may be there. It may be mutagenicity. Mutation may occur. It may be reproductive toxicity. Reproduction system may become toxic. It may be target organ toxicity. Some particular organ may be become toxic. And aspiration toxicity. Aspiration may occur. So, and flame over circle, oxidizer. These are oxidizers. So chemical waste and healthcare activities. These are the various chemical waste and some examples like acids. It may be, these are the examples of some acids: acetic acid, boric acid, chromic acid, hydrochloric acid, nitric acid, sulfuric acid. Some alcohols like ethanol, ethyl alcohol, isopropanol. These are commonly used disinfectants. Phenols also used as disinfectant. Aldehydes, chlorhexidine used as disinfectant. Formaldehyde, butylaldehyde as a name, Sidex, by the name of Sidex, used in the OTs and in the hospitals. Then orthomethyl aldehyde. Bases, like ammonium hydroxide, potassium hydroxide, sodium hydroxide. Then halogenated disinfectants, calcium hypochlorite. The hypochlorite solutions are used especially as a disinfectant for HIV infected material. Hypochlorite solution, chloride dioxide, iodine solutions, iodophores are used for as a disinfectant on the patients. Then sodium hypochlorite bleach is used for HIV. HIV sodium hypochlorite is used as a disinfectant. Very effective disinfectant. In the HIV laboratory, hypochlorite solutions are used. Then halogenated solvents like chloroform used for the in the OTs. Then methylene chloride, perchloroethylene, refrigerants, trichloroethylene. Then metals like arsenics, cadmium, chromium, lead, mercury, silver. Non-halogenated solvents, acetone, ethanol, ethyl acetate, formaldehyde, isopropanol, methanol, toluene, xylene. Then other disinfectants like hydrogen peroxide also used as a disinfectant. Peroxyactic acid, quaternary ammonium compounds are also used as oxidizer like bleach, hydrogen peroxide, potassium dichromate, potassium permanganate. Reducers like sodium bisulfite, sodium sulfite. Then miscellaneous anesthetic gases, asbestos, ethylene oxide, herbicides, paints, pesticides, waste oil, X-ray film fixer, and developers. These are the various chemicals which uh, can be there from healthcare facility and can produce some risk to the healthcare. Health risk may be there. Then impact of toxic chemicals on health. They can cause intoxication either by acute or chronic exposure and physical injuries like burns. Injuries to eyes, corrosive skin, or mucous membrane of airways can occur by inhalation in the mucous membrane of airways can occur by contact with inflammable, corrosive, or reactive chemicals. So this is some data. A mother can pass as much as 33% of her chemical body burden to her child. And 232 toxic chemicals were found in umbilical cord blood from US newborn. And pollution. By pollution, 4.9 million deaths were attributed to the environment exposure and management of selected chemicals in 2004. And HIV/AIDS, 2 million. And tuberculosis 1.5, traffic accident 1.3, malaria 0.9. So mainly pollution is by the this environment exposure and management. Then mercury is found in three major forms in the environment as methyl mercury, elemental or metallic mercury, or can be bound to other compounds. Sources of mercury in healthcare settings are nowadays it is banned, so mercury is not being used. Thermometer, previously it was used in BP instruments, dental amalgam, esophageal. Nowadays mercury use is not there. So then effects of what is the effects of environment on environment? Mercury. Most of the mercury found in the environment is inorganic, since mercury is never broken down into another chemical and harmless form. So it is not broken down. So once you have taken mercury, come in contact with the mercury, it is not broken down. So mercury permanently exists in the environment by changing its chemical forms depending on the environment. Flushing in sewers and dumping in municipal waste bins endangers the whole environment. So it will remain there. So it should not be flushed in sewer. And 1 gram of mercury contaminates a 20-acre lake with enough mercury to cause poisoning of fish. So very poisonous. Then effect of mercury on health. Methyl mercury has a capability to interfere with cell division. Cell division will be affected. It can cross blood-brain barrier and placenta. Pregnant women can and children are most vulnerable to the effect of mercury. Mercury is a potent neurotoxin. It can affect the neurological system, brain, and even at low levels of exposure, it can cause permanent damage to the human central nervous system. At higher concentration, mercury can damage vital organs such as lungs, liver, kidneys. So organ failure may be occurring. Then management of mercury exposure in healthcare settings. How you have to manage if mercury spill is there. If mercury spill is there, so first is that put on protective gloves and mask to reduce inhalation. Increase ventilation by opening a window. Switch off all ACs. AC should be switched off. All doors should be open. Ventilation should be there, and windows should be open. And use two pieces of film, straight edge plastic sheets. Take two pieces of firm plastic sheets and slowly guide the droplet together into a pool. So you just pick up that with these sheets and put it in a zip bag and use glass pipette with a rubber ball to suck up the mercury and collect it in the smallest size possible bottle. In a small bottle, glass or plastic, you use a pipette with a rubber ball to just you will suck with a pipette mercury and put it in a bottle with a tightly fitting lid. Alternately, you may be use syringe without needle. So either syringe without needle can be used for picking up or with a pipette, glass pipette. For picking up tiny droplets may not be picked up these syringes and pipettes. So you sprinkle zinc or sulfur powder on the floor. Collect all mercury content as per the above procedure. Then you collect after putting this. Label the bottle with mercury waste. Label that bottle with mercury waste and all mercury contaminated mercury items kept in a polythene cover as hazardous waste. Tightly close the container. Clean the mercury spill area with sodium thiosulfate and collected mercury waste as well as the all contaminated items should be disposed as hazardous waste through the authorized hazardous waste treatment, storage and disposal facility. So it should be taken as hazardous waste and should be disposed of. Then Z. What are sources of Z in healthcare settings? Major sources of Z from healthcare waste are dental amalgamation, where Z foils are used, and traditional X-ray packets, and Z aprons used in radiology department, Z acid batteries, Z paints. Effect of Z on the environment. Z X-ray packets result in the contamination of soil and groundwater in landfill area after disposal. Environmental pollution can occur when non-hazardous general waste containing Z from the healthcare institution is incinerated or burned in open. If it's burned, so environmental pollution. Water pollution due to erosion of Z from Z water pipes, supply pipes, and disposal of Z containing pharmaceutical in the sewer give rise to groundwater pollution. So, what are the effects of Z on health? Exposure to Z can cause effect on the blood, nervous system, immune system, kidney, and cardiovascular system. Exposure to high amount of Z can cause gastrointestinal symptoms, damage the brain and kidneys, and cause reproductive effects. Children less than 6 years of age are at maximum risk, and the organ affected are bones, brain, heart, kidney, nervous system, pancreas, liver. Then other heavy metals. Other heavy metals are aluminum, antimony, arsenic, barium, beryllium, nickel, helium, cadmium, and chromium. And fuel gases from incinerators are reported to release all the above. In incinerator, few gases are there, and after incineration, so to release all above heavy metals in different composition depending on the waste stream. Then disinfectants. Disinfectants are routinely used in hospitals for cleaning purposes, and these chemicals are very toxic and their exposure could lead to serious health issues. Commonly used disinfectants in hospitals are formaldehyde, glutaraldehyde, sodium hypochlorite. Hypochlorite is used in HIV settings, very commonly used, glutaraldehyde. Phenolic chemicals, chlorhexidine, citramide. So formaldehyde used as a formalin is used in pathological specimens, is used as embalming bodies in anatomy for dissection and for the preservation of specimen in pathology in an anatomy museum. Anatomy museum, pathological museum, specimens are put in the formaldehyde for preservation, and also for bodies also embalming is done for dissection. Medical students are dissecting the bodies, so the formalin is used as a fixative for histological specimen. Some histological specimen has come, for fixing that also it is used. Effect on environment, as it vaporizes easily, most of the formalin is found in the air, so vapors are there. So vapors come in the air and person inhales, and then effect on the health. Effect on the health, falling inhalation to lower concentration causes conjunctivitis, sore throat, coughing, and difficulty in breathing. In the body, it quickly breaks down into other chemicals which pass out of the body through the excretory system along with urine. Then glutaraldehyde, Sidex, colorless oily liquid available in the market as Sidex or Tocaside and ASAP. Use of glutaraldehyde in the healthcare settings. It's used as a sterilizing agent, cold sterilizant. Cold sterilizant means temperature is not increased after use of it. When you are sterilizing some material with glutaraldehyde, it is temperature will not be raised. So a tissue fixative in histology and pathology labs, embalming like formaldehyde, in the preparation of grafts and bioprocesses, and used to disinfect equipment. Equipment are disinfected, and that cannot be heat sterilized. Heat sterilized means generally autoclaving is used. Autoclaving is a heat sterilization procedure. So autoclaving is used for sterilization of equipment. Those equipment which cannot be sterilized by heat, there we use glutaraldehyde, and such as dialysis instrument, surgical instrument, bronchoscope, endoscope. These are the instruments which are used for sterilization by glutaraldehyde. Used in operation theaters, ICUs, and wards for disinfecting purposes. Effect of Effects of glutaraldehyde on the environment. It affects healthcare workers during the pouring of glutaraldehyde solutions into a sink or toilet due to exposure to the glutaraldehyde vapors. So glutaraldehyde vapors person can inhale. So effect of glutaraldehyde on health, it irritates eyes and respiratory tract, has a corrosive action on the conjunctiva and skin, may cause permanent injury to eyes, can cause severe allergic skin reactions like dermatitis, nasal and throat irritation, and headache, cough, and asthma-like condition may occur. Then sodium hypochlorite, which is used in HIV laboratory and or HIV for disinfection, and most widely used chemical disinfectant in healthcare settings and household due to its disinfection efficacy and affordability. Sources: disinfectant for spill management. If some spill management occurs in the hospital, then this is used for disinfectant of that area. Disinfecting bedpans can also in the hospital can be disinfectant by this. Sterilization of non-autoclavable, that is heat, the instruments which cannot withhold the heat sterilization. So sterilization of those instruments like endoscopes, bronchoscopes, and disinfection of infected plastic syringes before disposal. Effects of sodium hypochlorite on the environment. It does not produce any substantial ecological disturbance. Effect on the health. It is not a mutagenic, not a carcinogenic, not a teratogenic or skin sensitizer. But it irritates eyes and respiratory tract and has a corrosive action on the conjunctiva and skin, and headache, cough, throat irritation, and asthma-like condition may occur. And on ingestion, it causes nausea and vomiting. Best practices for the management of hazardous chemical waste. Minimization means minimum use should be done. Whenever required, only then, not a proper disposal. After use, it should be properly disposed. That is the only management. First is use minimum, and improper use should not be there. And once you have used, proper disposal should be there. So minimization options. What are the minimization options? Include that substituting highly toxic and environmentally persistent cleaners and solvents with less toxic. And so, if you are to use toxic chemicals, less toxic should be used, and environmental friendly should be used. Using minimum concentration where possible. Use only minimum concentration when possible. Ensuring good inventory control. Just in time purchasing. Only purchase when it required. Designing storage areas well. Store area should be well designed. Integrating pest management. Pest management should be there wherever you are storing it. Otherwise, pests will be there. They will just cut the bottles and extra and spread the chemical from one place to another. Keeping disinfectant trays covered to prevent loss by evaporation. So cover on that disinfectant tray. Developing spill prevention and cleanup procedure. So spill prevention and cleanup procedure should be there, and recovering solvent using fractional distillation. Disposable suggestions. Hazardous chemical waste of different composition should be stored separately based on compatibility to avoid unwanted chemical reactions. So chemical reaction should not be there. So hazardous chemical waste of different composition should be stored separately based on compatibility to avoid unwanted reactions and explosions, or to avoid fire hazards. If some chemical or two chemicals are can react, so those should be kept separately. And also explosion and if some reaction may occur, explosion may also occur. So avoid fire hazards may occur. So these should be put separately. Storage area should be provided with fire safety provision. Fire safety provision should be there. If fire occurs, fire safety provision should be. Large amount of chemical waste should not be buried because they may leak from their containers. And large amount of chemical infringement should not be encapsulated, as they are corrosive to concrete and sometimes produce flammable gases. Unused hazardous chemical can be returned to the original supplier, and all hazardous waste should be disposed of in accordance with the applicable hazardous waste management rules. Disposal of photochemicals. Photochemicals should be collected separately. First, recovery of silver from photo processing wastewater should be done using cation exchange, electrolyte recovery, or filtration by authorized recycler for recovery of silver. And spent solution after neutralizing should be stored for a minimum of 1 day. Spent solution after neutralization, first neutralize it and then store for a minimum of 1 day, and then send for further treatment through ETP. Thank you very much.
Thank you, sir.
Any question or any discussion you want to do, or how many persons are there? I could not get, because only two persons introduced themselves, and the rest I don't know were there or not. So how many are there now?
Sir, myself, Meera, I am still there.
Yeah, you are still there. And another one,
Sir Surbhi.
Surbi is there. Anyone else? I don't think anyone else is there. Only two persons are, I think. Meera, Surbi, and Seema Paz is not there. She's Pramod Sharma is also not there. They are their name is coming up, but I don't think they are there. So, okay, if nothing to discuss, then we can close, right? Right? Surbi, Meera.
Yes, sir.
Okay, then thank you very much for joining.
Thank you, sir.
Okay.
Thank you, sir.
Uh, I am Dr. Baveja, CP Baveja, professor, right? I was in Mazanajat Medical College, DC. I microbiology professor and head. From there, I retired 2 years ago, and now I am in GS Medical College as professor. Right. Okay. Thank you very much.
Okay, thank you, sir.